I'm going to go first to the Fort Peck Indian Reservation. And the Fort Peck Reservation sits in the very far northeast corner of Montana. And a little context about Fort Peck is that a Native American child born there today has a life expectancy that is about 18 years shorter than a non-Native baby that is born in the next county over. So for decades, the Assiniboine and the Sioux tribes have coped with the revolving door of temporary or underqualified doctors that you can imagine leads to perpetually understaffed systems of care. At Fort Peck, it has proven impossible to recruit a pediatrician to live on the reservation full time. And even over the years, well-funded, heroic tribal health efforts to use telemedicine have resulted primarily in expensive technology sitting unpacked and collecting dust in the corner because there just wasn't anyone on the other end of that connection who could be trusted or who cared enough to complete that circuit and just show up on the screen to help the nurses and to see those children. But over the last year, Montana Pediatrics we've changed that. And I'm going to tell you a little bit more about who Montana Pediatrics is in just a moment. But we were about 8 months into being the full-time remote pediatric practice for the Fort Peck Tribal School-Based Health Program when a 12-year-old walked into the one-room clinic. And the school nurse was there. The school nurse is a member of the small community. She knows the child. And she also knew that the child had already been through a serious bout of a COVID-19 infection. And this nurse she'd learned from the ongoing relationship with our pediatric collaborative that while this child wanted nothing more than to get to a basketball game that evening, medical return to play advice was evolving. And there was a potential risk that inflammation associated with the COVID-19 infection could have affected this child's heart, and it needed to be considered and evaluated. So hundreds of miles from the nearest person who had trained in pediatrics, the Montana Pediatrics doctor listened to the child's heart. And then with the help of the tribal health nurse, was able to get an EKG. And that salient clinical information, what was needed to care for that child, then traversed over 1,200 miles, and perhaps more amazingly, transcended the administrative boundaries of 4 different healthcare systems that day. But in a matter of hours, the information and the study were passed along to one of our pediatric intensivists, and then one of our member pediatric cardiologists. The EKG was read, it was deemed normal, and that young man made it to basketball that afternoon. As I mentioned, the organizing structure behind the care was Montana Pediatrics. In Montana Pediatrics, we have no single physical practice location, but we are instead a nonprofit collaborative of pediatric providers who are working together entirely virtually to offer remote care to Montana's children. And we do it as an extension of our own practices and in support of existing medical homes, as well as our rural colleagues and one another. So tucked into that day at Fort Peck, there's hundreds of lessons that we have learned as we've been running this experiment, as we've navigated towards a goal of access to high quality pediatric care for every single child in Montana, in every moment and in every location. But of all the many lessons, I think there's 2 that I want to focus on with you guys today. The first is we have embraced a fundamental shift in how we choose to see one another as experts, as pediatricians, and as colleagues. While we do work for competing healthcare systems who, yes, are busily calculating market share, our providers, who represent the majority of pediatric providers in Montana, have chosen to embrace one another as essential partners in order to create the ability to serve more children. We have learned that we can do more together than we can alone, and we can do it in a way that we believe creates community rather than burnout. We can offer 24/7 access to care across Montana's 147,000 square miles and take call less often. We can compete with technology first, direct to consumer models who are a threat to continuity, to health equity, and to our fragile rural healthcare ecosystem, and still plan to sleep through the night more frequently. We can do more together than we can alone. The second lesson we continue to learn is about the nature of access to care. And the lesson is this: access to care, it's only real. It's only access when it's offered on the terms of those that we strive to reach, that we are striving to advise and to heal. Of course, Fort Peck has taught us that at every level, but so have some important people who live not hundreds of miles from the nearest pediatrician, but within sight of one of Montana's largest hospitals. We recently dedicated ourselves to working with an organization called the Mountain Home. The Mountain Home provides shelter and services to young mothers who are in crisis and who need somewhere to live while they are pregnant or raising young children themselves. But unlike Fort Peck, the Mountain Home is located literally across the street from a major medical center and two of our local largest pediatric practices. So for this reason, it may seem like a less likely location to tout the virtues of telemedicine. Yet it was here that we heard another story of access to healthcare. A mom, 19 years old, who struggled with addiction, has had involvement with Child Protective Services, and who's trying, to raise an infant while meeting the demands of her own court-ordered treatment as she attempts to work her way to her own financial independence. Without any healthy familial relationships or support, her common, normal, frequent worries about her child's health are often answered by social media or input from her makeshift community of other young women. When we asked the Mountain Home moms what it meant to seek healthcare for their children, they didn't say, walking across the street is the barrier. It was the experience. It was the experience of the emergency room as the only place that was open when they needed it, but from which they felt dismissed and shamed for bringing minor issues, and where they were treated with suspicion when their history of CPS involvement emerged. These moms had learned not to trust and that they were not trusted. They were always instructed to see their primary care provider, to which they told us they either had no such relationship or the unrealistic and unbending appointment times offered conflicted with their own work or mandated treatment times. So we offered access to care. It was the highest quality, locally knowledgeable, pediatric-specific care, and it was via their phones from the safety of their rooms. And in the first 2 days, we actually had 2 visits from the same mom twice. And after the second visit, she sent us a note. She wanted to thank Dr. Cole and she wanted to thank Dr. Wilson. She wanted to thank them for being there. She also specifically thanked them for not being mad at her, for coming again for help with the same issue. And then she described greater trust in healthcare, as well as a better understanding of her own child's health. The ER was open. The pediatrician's office was across the street. That access was created when we met her on her terms. Working together as Montana Pediatrics has meant that as a community of pediatricians, we can now personally afford to be part of increasing access to care in Montana, creating medical neighborhoods for medical homes while we support one another. And we hope that being present in these most remote and these most unlikely locations on the terms of those that we strive to serve is increasing real access and maybe earning back greater trust in healthcare in this time when it is so immensely important for all of us.